Hello, good evening. Welcome to our Global Health and Development Student Webinar Series. Today, we will be discussing very interesting topic about the 2021 Myanmar coup dated impact on the country, healthcare, and COVID-19 response. So in very relevant to this topic, we have two panelists, including me, myself. My name is Dr. Heng Minto. I am an assistant professor at the School of Public Health. Also, I'm originally from Myanmar. I'm Myanmar citizen. And together with me, Dr. Piu Piu Dingzor is also with me. So she's also a lecturer at the School of Public Health. Today, our webinar will be starting with the presentation by Dr. Piu Piu Dingzor, and followed by my additional kind of discussions. And if we have time, we will also open some discussion to the floor. So without further ado, I would like to give the floor to Dr. Piu Piu Dingzor.
So thank you so much, Dr. Heng, for your kind introduction, and welcome everyone to this webinar. And before we start this, let me share the screen first. So thank you. Can you see the screen clearly? Okay, so welcome everyone again. Today we are gonna talk about 2021 Myanmar coup d'etat impacts on the country's healthcare and COVID-19 response. So is that okay? Can you see this?
Sure.
Okay. So first, I would like to give you the basic background of the coup. So what is a coup? A coup is a sudden, violent, and illegal seizure of power from a government. Myanmar, also known as Burma, is a Southeast Asian country bordered by Bangladesh, India, China, Laos, and Thailand. On 1st of February 2021, the military seized full control of the government after arresting State Councillor Do Aung San Suu Kyi and the President U Win Myint, the nation's civilian leaders, and the top members of the National League for Democracy during a raid. The military claimed election fraud, but so far there is no proof. So the nature of the current coup is criticized as unconstitutional, not legitimate, not in line with international human rights standards, and it's happened amid COVID-19 crisis. Historically, from 1962 until Myanmar with an iron fist, asserting their absolute power over the people through fear and brutality. It had been only 10 years that Myanmar started to experience a restricted democratization process. The efforts to regain the democracy system in Myanmar faced a lot of obstacles, and this recent military coup terminated all the hopes that was lingering before. So this slide shows the summary of the domestic and international resistance efforts towards the military coup. So this is, I credit this to Minte, who is a contemporary writer and analyst on Myanmar politics. So we can see that there are civil disobedience movements carried out by civil servants. Also, we can see that there are nationwide protests during the daytime and pots and pans campaign, which is happening at night. And politically, there is a committee, which is called CRPH, which represent the parliament. And it is challenging the legitimacy of the coup. We can also see that there are a lot of international sanctions being imposed by the United States, US, UK, and international community also condemned the military coup. You can also see various activities of international Burmese community outside the country acting synchronistically simultaneously against the coup. And we can also see some actions taken by ethnic armed groups. And the role of local and international media is also very important when we talk about Myanmar coup. So soon after the coup, the protests are occurring daily, huge in numbers and bravely, passionately defiant. For example, on 22nd February 2021, there are estimated 20 million people protested across the country. Tens of thousands of people have joined the biggest rallies to oppose the military coup. So it's hard to describe the incredible energy that people have shown. The people who joined in these protests cut across all classes of society and generations. Different ethnic groups, religious groups also participated in these protests. At the heart of these demonstrations is Generation Z, a broad demographic of young people born between the late 90s and 2012. They appear self-confident, wanting the military. You messed with the wrong generation. Generation Z members are often described as digital natives, known for their social media and internet savvy. They can not only get around government blogs or news, but also can organize mass movements with creativity and with the help of pro-democracy activists from nearby countries like Thailand and Hong Kong. So they are also calling for regional alliance, which they call MIKTI alliance. They ask for the transnational solidarity, which includes shared protest tactics and strategies that shows the growing influence of cross-border youth movements pushing for democracy. Responding to their call, some young people in Taipei, Bangkok, Melbourne took to the streets waving MIKTI alliance signs and flags. So it is fascinating to look at democratization movements across the world take inspiration from each other. On the other hand, non-stop and escalating human rights violations are happening inside Myanmar. Since February 1, martial law was announced. There is a curfew from 8 p.m. until 4 p.m. and a ban on gatherings of more than 5 people were declared. Countless human rights violations across the countries are happening right now. The military units block the roads. NLD members who are civil society leaders and other activists have been jailed, and multiple types of communications have been cut off. So casualties and human rights violation by 1st March 2021, there are over 1,100 individuals have been arbitrarily arrested and detained. A total of 32 peaceful protesters died due to lethal crackdowns by the armed forces. Some of them were died because live ammunition were used, and some of them were shot dead, aiming the guns at the head. So among different social groups who joined the protests, such as artists, bankers, railroad workers, teachers, LGBTQ activists, trade unions, students, etc., I would like to pick up the relevant group to our topic, which is called the White Coat Alliance. In response to the coup, almost all public sector medical workers from 245 townships across Myanmar began a civil disobedience movement, which is known as CDM, and refused to work under the new military junta. Within 2 weeks, the Myanmar public healthcare delivery system has totally stopped, including a mass COVID-19 vaccination program, which started just 1 day before the military coup. So Myanmar doctors also has to face a biggest ethical dilemma. They understand that the duty as doctors is to prioritize care for the patients. But they said that, how can we do this under an unlawful, undemocratic, and oppressive military system? So in this photo, the doctor says, Myanmar is in emergency. Let me save the country first. Like civilian protests, forceful crackdown on the peaceful protests of doctors and medical students are happening in the country. In this photo, the dental students are being surrounded by police forces on 28th February, and medical students and dental students preparing themselves to protect these forceful crackdowns. And you can clearly see that the protective sheet with a makeshift sheets and barricades are not strong enough to protect them from any lethal forces, but their determination is unbreakable. So in these photos, the doctors were brutally cracked down and lots of medical students were arrested forcefully. And you can see that this doctor has three finger salute, which is a symbol of defiance. Also, the police took off the duty coats of the medical students by force. You can see that in these photos. So, how all these events might impact Myanmar's healthcare system? That is today's topic. To understand Myanmar health system, we should have a look at the historical background of Myanmar health system. We categorized Myanmar health system into four periods, which is colonial period, started from 1886, ended at 1948, and Myanmar health system is adopted from British health system, which is similar to Hong Kong's health system. And then another period is after independence. At that period, there are a lot of political arrests, and Myanmar health system was temporarily interrupted due to armed conflicts. And then from 1962 to 2011, it is military regime. During this time, due to lack of government investment in healthcare, as well as restrictions of IMG or provision of health services in the country health system is ranked the second worst in terms of health system performance by the WHO in 2000. From 2011 to 2021 is democratization period. And then you can see that we have some interaction in the past, and this military coup also make the health system collapsed. So during the military rule, which is from 1962 to 2010, the health expenditure is very low. For example, total health expenditure in Myanmar is 2 to 2.4% of its GDP, which is the lowest among countries in the World Health Organization. Its performance is second worst in 2000 in terms of overall health system performance. There is no health insurance system at all, so estimated 3/4 of Myanmar's citizens find themselves with very limited access to essential health services, and many millions are forced into poverty due to healthcare costs. From 2010 to 2020, it is democratization process, and we can see some improvement. We call it democratic progress. For example, life expectancy is increased from 63 to 66.9 years, and there are a lot of people getting out of poverty line, and then GDP is also increased, corruption perception index, things like that, and democratic index, all are increased. So system-wise, specifically for health system, progress are also seen from 2010 to 2020, significant increase in health expenditures, for example, 2.4% in 2012 to 5.4% in 2015, which is almost ninefold. And there was a large influx of international development partners and donor funding into the country. And the social protection system is being discussed and it is under the development. Having said that, health expenditure is still the lowest compared to other countries in Southeast Asia region. And Myanmar health system is typically fragmented due to its long-lasting ethnic conflicts. So we have to understand that Myanmar health system is facing a very important transitional period. So then here came the COVID-19 crisis. Myanmar's fragile health system is exacerbated by the COVID-19 pandemic. According to the 2019 Global Health Security Index, Myanmar's health system is the least prepared in terms of the health system's readiness to deal with even a moderate-sized outbreak. The coup will definitely do enormous damage to the country's already suffering health system. So let's look at the immediate impacts of the coup on Myanmar's healthcare. So the civil disobedience movement means no recognition, no participation stance to the military regime. As there are estimated 1 million civil servants and about 3/4 of them had walked off their jobs. Healthcare workers from dozens of state-run hospitals and institutions initiated the CDM starting 3rd February 2021. Over 1,100 hospitals and healthcare agencies from 245 townships have participated in this movement. By 9 February, COVID vaccination had been suspended and most hospitals in Myanmar had shut down. So let's look at the short-term impacts. We have 6 building blocks of health system by WHO. So health system leadership is also interrupted because there are leadership changes. The Ministry for Health was removed, it's abrupt, and there are some mismatches. And then all the medical universities are shut down. National health plan activities are being stopped. International aid organizations condemned the military coup and declared that they will only support the humanitarian needs. Crackdown on doctors, dentists, nurses, and medical students will lead to a severe shortage of manpower, and it will totally shut down the whole system. So COVID-19 responses or any disease control activities are now completely halted. So, according to Norwegian Refugee Council, it is estimated that, it is postulated that there could be impact on the humanitarian situation and relief operations in the country. Aid groups are now already restricted. There are estimated 1 million vulnerable people which currently are in need. So some conflicted areas are not reachable right now. Humanitarian needs could escalate rapidly and with devastating consequences. So this is the worst time for any political instability to happen because it is amid COVID-19 crisis. Some people or some experts worry that the military might exploit the COVID-19 crisis to introduce policies such as increased surveillance and emergency security measures that undermine democratic principles and violate the civil and political rights of both citizens and migrants. In terms of vaccinations, It is set to begin in February, but the people doubt the military's ability to roll out vaccines or control the outbreaks. People aren't getting tested, nor isolated or vaccinated since the coup. So it clearly indicates the system collapse. In the military's media, the vaccines program keeps going on, but the public claim that they do not actually get the vaccine. In this photo, this lady says, "I am over 65, but I haven't got COVID-19 vaccine shot." There are a lot of long-term consequences that we can foresee, but I will only pick up 3 consequences here. First, leadership insufficiency. Second, failures in disease control measures. Third, severe brain drain and health manpower shortage. Trust issue is very important in Myanmar health system because all the Myanmar health professionals disapproved any military appointed leadership. Since 2015, the civilian doctors were against the appointing of military persons in healthcare management system. They don't trust the military. So without effective governance, the whole health system will become insufficient. When we look at the vaccinations, what would happen if we stop regular vaccinations? So we could soon find ourselves battling epidemics or diseases that we thought we had conquered decades ago. History gives us some idea of the nightmares that we would probably see. For example, in Sweden and the Netherlands, there were outbreaks of measles in 1992 to 2000, resulting in about 2,500 cases and some deaths. We can also foresee ineffective disease control measures. Failures in effective disease control measures in Myanmar will lead to drug-resistant tuberculosis, drug-resistant malaria, and uncontrolled COVID-19 outbreaks and other emerging infectious diseases. Let's take an example of malaria. More than half of confirmed malaria cases and deaths recorded in the Greater Mekong sub-region occur in Myanmar. So the WHO is concerned about the so-called super malaria parasite in Southeast Asia. And there could be severe manpower shortage, in other words, severe brain drain. There is a global shortage of approximately 2.3 million physicians, nurses, and midwives worldwide. Local shortages of health workers in developing countries are worsened dramatically. Doctors, nurses, and dentists from Myanmar are now very likely to migrate abroad, not only for the economic financial drive, but also due to political suppressions. So what about the impact of the regime type on health across the world? There are systematic reviews suggesting that democracy has a positive relationship with the health of individuals. Authoritarian regime has a negative relationship with the health of individuals. Government instability is negatively related to individual health via its link with the quality of the healthcare sector. Most military regimes' policy of secrecy and denial towards health problems and the neglect of its healthcare system usually leads to millions of life loss. So what about the regional impacts of the Myanmar coup? Enough evidence proved that political instability in a country negatively affects the health state of the bordering countries. For example, the influx of refugees, the dissemination of the diseases. What if COVID-19 pandemic not ending in Southeast Asia because Myanmar cannot control it? So the likelihood that drug-resistant malaria will spread from the Greater Mekong sub-region to India and Africa, the WHO stated that. Southeast Asia should understand that the situation in Myanmar is critical. So let's look at the political impacts. Myanmar coup will push the region towards democratic regression. If Myanmar coup is allowed to continue, Southeast Asia could be in a long-term spiral toward authoritarianism. The regional instability has a strong negative effect on a country's economic performance, which is called the neighbor curse. Studies also show that such political alteration, ethnic conflicts, tribalism, wars, coup d'etat has serious impact not only on the economic growth, but also diversely affect neighboring countries known for their relative stability. So let's look at the global impacts. At any time, an emerging lethal and highly transmissible pathogen might pose a risk of being spread globally because of the interconnectedness of the global population. Even geographically limited outbreaks, such as the Ebola virus disease in Africa, might have a global effect. The WHO recommended that vaccinating the whole planet is essential to control COVID-19 pandemic. So what if Myanmar is left behind in COVID-19 vaccination? So this is a webinar for the GHD students. So I would like to talk a little bit about how GHD graduates can contribute to global health crisis like the Myanmar coup that transcend national and professional boundaries. You can clearly see that Myanmar coup amid COVID-19 crisis is a global and interdisciplinary issue. And you can clearly see the importance of political determinant on health. The political impacts should be examined not only on healthcare, but also on economics, education, social, and geopolitics. You should learn by making connections between ideas and concepts across different disciplinary and geological boundaries. So I would ask you to take action for global justice with innovative ideas and create a more peaceful and prosperous world. So this is the end of my presentation, and thank you so much for your attendance as well as your time listening to my presentation.
Thanks, Dr. Piu Piu, for your very nice presentations and very informative about what is happening in Myanmar and how that could impact to the Myanmar health system, that's recently already collapsed. So I just want to reiterate a few important points, here, because the coup in Myanmar, people may think it is a kind of country issue, one of the very small country in Southeast Asia, that is they think it's a local issue, but actually you already kind of pointed out that this is not only a local issue. It can also be onto the regional and also a global issue in many ways. So I think this is a very important kind of case study for our GHD students, who will be learning how, a country issue go beyond to the regional and global, as well as how the political issue can impact to the different kind of sector, including health and also economic sector in the country and also in the region. So of course, the issue is kind of very important, not only to the Myanmar, but also the ASEAN region. Is already indicated by the ASEAN ministerial meeting yesterday, and a member of the ASEAN, state already indicated that, the issue, Myanmar issue, is really kind of threatening the stability of the region in the country, and also across the region. So it is very important. And another thing I really want to kind of point it out how important the leadership and also the legitimacy of this leadership in the health system, governance, and also in politics. So you can see now the trust on the leadership in the country in Myanmar, and also that is really impacting the collapse of our health system. So luckily, we have a new junior minister appointed by the CRPH, the committee representing the Pitang actually founded by the more than 300 members, elected member for the parliament. So they appointed Dr. Zoe So, Professor Zoe So, the rector of the University of Medicine 1 as the union minister of health yesterday. So this way we have kind of alternative route. How can we reinstate or revive our health system, with the help of the international supporter and also global health institutions. So Dr. Zoe So also kind of published a correspondence in Lancet, and I would like to kind of quote here in what he wrote. He indicated that the international police and global health partner are needed to coordinate and support the COVID-19 response through humanitarian pathway that ensure ongoing testing, treatment, and immunization. I think this is the time for all the global health institutions have to think of how to coordinate with the legitimate leadership, to assist in the COVID-19 response and also reinstating or reviving, the Myanmar health system, without supporting to this military appointed, leadership. So this is very important. And also another point of health-related issue I want to indicate here is about the mental health crisis. So mental health, issue has been neglected in the country like Myanmar for many decades, and of course there's a lot of literature supported that the social unrest or political instability really impact the mental health status of the people. So our School of Public Health at the University of Hong Kong also study a few, instances like, social unrest in Hong Kong or Syrians, political instability, how that impact on the mental health situation in the populations. So I think this is also an important point that we need to also monitor and look at how the mental health impact in the country due to this military coup. So another point I also want to point out the humanitarian, crisis. So because you can see in the photo, that you present, the police force, is just pointing the volunteer first aid, to help to the protester. So this is really kind of human rights violations, and I think the international, body have to take some actions and also have to voice out on that, because all the medical aids during the protest should be kind of protected, and that is very important. And without delays, I think I want to kind of open the floor for some discussion and question if you have, and we can try to discuss on that.
Thank you, Dr. Haim.
Oh, there is one question in the chat room. I want to kind of read it. How does the pandemic affect the international community action on Myanmar courts and healthcare system? Do you have any answer on this, Dr. Piu?
Yes, Dr. Haim, thank you so much. So Ying, thank you so much for asking this question. This is an excellent question. Because all the countries are battling with COVID-19 pandemic by themselves, because there are lots of consequences by this pandemic, I would say that the response towards the Myanmar coup by the international community is not very quick enough. because this is a very devastating time, not only for Myanmar, but also for all the countries in this planet. So I would say there are some delays, and some people actually cannot make much effort, not because they don't want to, but because they have problem. For example, vaccinations. Many developing countries didn't get enough vaccinations. And this is a global dispute about health equity and equality, right? So Myanmar is also a very poor country, and we don't actually have enough vaccination yet. And how could the other poor country help Myanmar while they are also having same crisis?
Great. So there is one participant want to ask question. I allowed to talk. Zor, can you unmute and ask your questions? Or
hi, thank you for the very informative talk. Just wondering your thoughts on the responses of ASEAN to the coup so far, and do you have any like what could be the how could, like, is it satisfactory, or like what could have been a better response if it's not satisfactory? Thank you.
Thank you so much, Saul. This is an excellent question. So my answer would be based on personal opinions alone, because the coup is quite recent and we don't actually have enough evidence. So in my opinion, the ASEAN's response is not satisfactory, because like Thailand, Philippines, they are also battling the authoritarian leadership. So they would not support the People Democratic Movement as much as we want them to be. But I think that Indonesia's response and Singapore's response is better than compared to those authoritarian countries. So as I stated, the democratization process in Southeast Asia is not satisfactory. So it is not surprising to receive such kind of not encouraging responses from ASEAN countries. But I think we should push a little bit on Vietnam, because I have witnessed that there are a lot of activities in Singapore against Singapore, China, Thailand, and Indonesia, but people actually don't push enough the Vietnam's response, because Vietnam is playing a very, very important role right now. So what can we do? It is a very difficult question. I think the actions coming from their own people would be more effective than diplomatic measures. Like the Generation Z is connecting to the young people across the countries, right, in ASEAN. I think this is the best way. So the youths responding the calling from Myanmar youths is really fascinating, because only their people can push their governments in the long run. So I would choose this approach as the best. I mean, pushing by people to connecting people to people, and pushing each government by their own people.
great. I also want to add to answer this question. So actually, everybody know that ASEAN has been very silent in most of the political issue within the region, but this time is a kind of a little bit different. You can see the statement came out from the ASEAN ministerial meeting yesterday. So some country like Singapore, the foreign minister, he indicated that they are not recognizing this military coup, and the government found by this military junta. So this is really a strong point, that they are, unilaterally kind of opposing this coup, and also they demand for the immediate release of the State Councilor Aung San Suu Kyi and also the President Win Myint. So this kind of pressure have been seen in the history of the ASEAN. So I also want to kind of see as a positive point on that, you know. Okay, so we also have a few questions to answer. And if the audience want to ask questions, please feel free to write in the chat box. So another question here from Neo from Jutendo University. He asked about what is the role of UN in this crisis? Piu, do you have any answer for this?
Oh, thank you. So thank you so much, Neil, for your question. The role of UN in this crisis is, of course, enormous. This is a very legitimate international body that could resolve a lot of disputes and human rights violations in our country. So I would say it is so important to communicate with the UN and to get support from the UN, especially CRPH, to get legitimate support from the UN, because this is a time competing the legitimacy between the military coup and then people's elected government. So I would actually see UN as the most important international body that we should rely on at this time of crisis.
Great. So there's a lot of questions so from the audience, so we should better move on to another question. So is there a possibility of herd immunity for COVID-19 in Myanmar as a result of mass protests? If so, how can Myanmar people prove that and shift the COVID-19 funding to some better cause? The options are quite limited though. So it is asked by the Imon Tengju, you know.
So Dr. Hay, I would really request you to talk about herd immunity in this case, and I would cover some after you. Thank you.
So I think in order to get the herd immunity, there is so many considerations. So of course, a lot of people are thinking that this mass protest can also lead to the herd immunity, but I think this is very unlikely because most of the protesters are now the young people is the Generation Z, and we don't know the infection spread within the protest currently, and that is a neglected issue at the moment. So I think we need to first understand how the infection spreads during the protest and how that could impact to the other vulnerable population like elderly people, and that is we need to see because it takes time to get the evidence. And I think the funding for the COVID-19, I think now we even don't know where is the funding for the COVID-19 vaccinations because since the military coup, the whole healthcare system has been collapsed and the funding has been not really known by the people. So I think it is hard to say whether we can use this COVID-19 funding to other better cost. But this is just assumption. Okay, let's move to another question. So another question from the phone. The CRPH just announced a new temporary minister for health, but they are now running and hiding from the police, to my knowledge. How much likely to have another parallel healthcare system to be built quickly? So I think maybe you have some idea to answer this question.
Yes, Dr. Haim, thank you so much. Actually, I feel really deeply moved by this question because, this is a time we are competing for the legitimacy of I wouldn't say military coup as a government, but two governments, even though military coup is not a government. So that is really hard to say because to get the legitimacy, we need first the people's support, second, international support like UN, and the third is law or parliament. As you stated, the condition is quite tricky. We are sure that the people supported the CRP8, but all the members of CRP8 are now hiding or running because the military is cracking down on them. And then to get the legitimacy from international community, they also need to issue statements like Czech Republic, saying that they supported the CRPH alone and condemned the military. So they have to declare that openly and loudly. Even though CRPH got people's support, which is another way of legitimacy, yeah, it is really hard to tell. So I really don't want to answer your question, but from people's perspective, we have to support this parallel Ministry of Health by all means if we don't want the military rule. Is quite sure from my side. This is personal opinion.
Yeah, great. Yeah, we have another question from our GHD students, Shui Ho Hing. So he asked about the sovereignty is the often seen contradictory to international interference. How can a balance be created between these two? And through what means could possibly the international stakeholder help to achieve better health situation in Myanmar in these situations? It's quite similar. Yeah.
Quite similar, but also different, because the national sovereignty is held very important by each country, and it is hard to interfere the domestic affairs unless it became global threat. In Myanmar case, I really see this as a global threat and not only domestic affair. So if the international people would like to interfere, would like to stop the severe human rights violations, the brutal killings and crackdowns, I would encourage to forget the sovereignty, just interfere. But even though I said that, there are lots of consequences after any movement being done by international community. So it is understandable that there are so many delays to act against the coup. But if the crackdowns, if the violations kept going on, Myanmar can't stand anymore, the health system is totally collapsed. The consequences will be arising soon. We don't see it yet because it's only 4 weeks, but we need to actually resuscitate the health system and the whole country as soon as possible. So it is a kind of values clashes, sovereignty and human rights violations. I would say I would choose to stop human rights violations by all means, rather than keeping the country's sovereignty as a value.
Yes, I think your point is very good, Fifu. So I think this is the time that the international community, especially United Nations member states, have to choose whether they want to protect the human right or they want to respect the sovereignty. So this is a very challenging for them, but I think they can make a right decision to protect the human rights violation in the country that we have in Myanmar now. Okay, so we will move to another questions from Yedana Ao. So she asked, the question is, any soluble way to overcome COVID-19 hesitancy at the time of legitimate military coup? Illegitimate military coup, sorry about that. Delayed vaccine has been happening because of political unrest. Then how can we proceed to accept the vaccine at the time of civilian government? One elected official will take the office.
Dr. Heng, could you please answer this question?
Sure. So I think, as you can see in the situation in Myanmar, just before the coup, so Myanmar faced the very big challenge of the COVID-19 pandemic since the middle of 2020 until early 2021. So we have an increasing case every day, and also our health system is very inefficient and also very weak. So But you can see very tremendous, effort that put by the democratic government and also the people that support the democratic government at the time. So we have so many kind of COVID-19 center in order to isolate and also treat those patients and also do the kind of contact tracing. That is really out of my expectation, because I never think we can do such that effort. But we actually, with the kind of legitimate governments and also the right leadership, we could do that. So I'm sure that after the coup, and after we solve this political problem, we can definitely do this COVID-19 vaccinations in a short period of time for sure, under the leadership of the civilian government and also the right leadership. Okay, so we can move to another question from Shi Chen Chen. It is likely the CDM in Burma will succeed in the near future. Is there any way to exert enough pressure to make the military regime back down? Thank you. This is a good question.
So, Dr. Heng, could you please repeat the question, because I couldn't see the questions.
It is likely that the CDM in Burma will succeed in the near future. So the question is whether the CDM movement will succeed in the near future. Is there any way to exert enough pressure to make the military regime back down? Thank you.
Okay, that is a very great question. So to have a successful civil disobedience movement backed by the evidence, there are a lot of factors that we need to consider. First, it's the how much robust the military junta is. I mean, how many people are on their sides. That is one factor. And second is the resilience of the civil servants, how long they can stand those brutal crackdowns or hiding from the military, running away from the home, separated from their families, how much endurance they have. Second, how much the public could support them. Because in my opinion, CDM is the most important and the most effective tool to fight back against the military junta. So it is of vital importance that public support the CDM people as much as they can. If there is no civil servants, how the government would run? So clear, right? So in this CDM movements in Myanmar, as far as I have, the data stated that third quarter of 1 million civil servants participated in this CDM. So the evidence showed that if only 2/3 of the civil servants participated in CDM, that could likely win. So in this case, we have 3/4. So I think this is a pretty good situation. And then another thing we have to be prepared is to build up a ready-made government, which is being conducted by the CRPH right now, like forming the ministers, appointing the minister, as Dr. Heng stated. So once the military back down, we have to be able to replace it with already formed resilient government. We cannot take time. It has to be very quick.
So I just want to add a few points here. So I think if we really want to make this military regime back down, we need a few pressure to put it in, based on my personal opinion. So one is the international pressure. That is a very important. So the pressure from the United Nations member states and also ASEAN member states, they are very playing a critical role and an important role in making this regime back down. And also another thing is this also the internal forces, within the military. I hope that I'm not sure that how much possibility that we have, but I also hope that there will be some people in the military who want to protect the people, want to, against this military coup. Then they can take some kind of pressure to the current regime, but this is, all we know that is very less likely, but hopefully we can see some time, in near future. But, and also the civil disobedience movement is really important in Burma and to threaten the current regime. And there's a lot of evidence that, the military is really taking, a lot of pressure from this CDM movement, in different means. So I think continuous CDM movement is also a good and also a good pressure to this, military regime to back down. Okay, so we have a question from Lee Jia John. So the question is that thanks for the lecture. Are the lectures and seminar in GHT program similar to this amazing one? And of course, we our GHT program, team will try our best to make sure all the lecture and seminar like this one, and even better one, So hopefully, please feel free to join our GHT program in the future, and then you will be seeing quite a lot of interesting topics and also lecture and seminar. Okay, let's move to another question from Carol Koch. So during 1960 to 2010, the health and human rights are of the least concern for the military regime. Civil disobedience movement is hurting the citizen more than the regime, like shutting down hospital, walking out of the office. What will be the pain point for the regime to turn from democratic regression?
So according to my understanding, the question stated that whatever actions international or we took, the regime didn't care about it, and then the harm directly went to the people. So the question asked if doctors walking out of the hospitals might have positive effect on this military, right?
So the question is this, the person asking the question that the CDM movement is hurting the citizen more than the regime.
I see.
But actually, I think this is not true, and the regime also got a lot of, problem with this CDM because they got a lot of pressure and they cannot even stabilize the governance system until now, even already a month since the coup. So I was personally, I think CDM movement, of course, there is some impact on the citizen, but also it significantly affect to the regime. How about Piu Piu? Do you have any idea?
Yes, I just would like to second your answer because due to CDM movement, the current coup is not legitimate yet. It is mainly because of the CDM movement. Without civil servants, how would they call themselves as government, right? And then without cooperations of the civil servants, how would they run the government? So you have to be able to see CDM as the most effective tool against the military coup. Like Dr. Haynes said, there are a lot of consequences because of the CDM. And I also mentioned that doctors, for example, doctors also have ethical dilemma before they went out of the hospitals, but they also prepared like public hospitals, emergency, temporary care, and they just don't leave their patients, actually. They make sure that their patients would get enough care that they need before they left the hospitals. And they also feel bad inside. We call it ethical dilemmas, But as they stated, if we let this military coup going on, we see 32 people are shot dead, but in the long run, millions of lives will be lost. So it is in the utilitarian stance, I mean, risking a few people right now is worth, because we would save a lot of people in the long run, you know. These are the justifications being given by the doctors. And I would say, because I really study the military's health system, and I found that life expectations, unnecessary deaths of maternal mothers and child, countless deaths in the past, because there is very weak governance. So we can't let it happen. We have to take any measures we can to prevent the military regime in our country, because we learned enough, we know enough. I think that is why people push civil disobedience movement a lot in the country. And as Dr. Haim said, without civil servant, how would the military call itself as a government, right? Very clear.
Great, so we have a very kind of limited time now. So I want to go to another few more questions. The next question is, could you please tell a little bit more about the current situations of health-related INGO in Myanmar? Their activities have already been restricted due to COVID, and also now due to the coup. I wonder what they are allowed to do now. What can they do to help?
Oh, well, this is also a very good question, you know. So there are two parts. First is how military treat them, and the second part is how they treat the military, you know. So I have seen lots of statements by international NGOs stating that they condemn the military coup. For example, MSF, they decided that they would only support the humanitarian needs and wouldn't cooperate with the junta. So I think this is really a positive action by the INGOs. And, you know, from the military side, in the past, they used to restrict the INGOs' activities in the country. Compared to international countries, developing countries, Myanmar is one of the countries which received very little international aid. So this is still too early to say, because it is only 4 weeks. But, you know, I don't even know what to expect from INGO, because we will definitely need humanitarian support after COVID-19 crisis, as well as this a political crisis. So I really want all the INGOs don't leave the country. But on the other hand, I don't want them to cooperate with the junta. So this is a kind of ethical dilemma, and I'm pretty sure that some of the INGO leaders might be feeling the same dilemma.
So great. So we can move to another question from Seoul. And this is the last questions. And sorry about that. There's so many questions in the chat, but we will try to answer by mail. Or if you have a question, you feel free to contact the panelists. You know, the last question from Seoul is: we can bring sovereignty and human rights violation together if the CRPH can form a viable government, at least recognized by the UN and through their representative at UN, request the UN intervention. Is there a possibility in the coming weeks?
Thank you. Excellent. Thank you for your comment.
Yeah, I think the question about this, you know, UN interventions, you know, I think you can also see the situation has changed. One of the very historical, you know, evidence that we have, mostly the UN representative of Myanmar is always listen to the government, and if usually, you know, the one who has more power. But this time, you know, our ambassador, you know, permanent ambassador at the UN, has stand for the people and explain all the situation happening in Myanmar in a true way. So that's why I think the UN also now really understand the situation really happening in Myanmar, and hopefully some of the intervention will come in a few weeks' time. And that is also our wish and hope. The UN also will listening the voice of the from the people of Myanmar. So let's hope for the best. With that, I think we should kind of end this webinar. So okay, so thank you very much for participating in today's webinar. Thank you.